A stroke is a serious life-threatening medical condition that happens when the blood supply to part of the brain is cut off. Strokes are a medical emergency and urgent treatment is essential. The sooner a person receives treatment for a stroke, the less damage is likely to happen. If you suspect that you or someone else is having a stroke in a place like the UK, phone 999 immediately and ask for an ambulance in the hinterland or a developing nation. It is time to look for available transport means to take the person to the hospital. For information purposes, I will be using 999, which stands for emergency phone for the UK. So in your place of residence, I believe there is a different organization or approach available for this emergency call or situation. Symptoms of a stroke. The main symptoms of stroke can be remembered with the word fast face. The face may have dropped on one side, the person may not be able to smile, or the mouth or eye may have dropped. Arms. The person with a suspected stroke may not be able to lift both arms and keep them there because of weakness or numbness in one arm. Speech. Their speech may be slurred or garbled, or the person may not be able to talk at all despite appearing to be awake. They may also have problems understanding what you're saying to them. Time. It's time to dial 999 immediately if you see any of these signs or symptoms. Causes of a stroke. Like all organs, the brain needs the oxygen and nutrients provided by blood to function properly. If the supply of blood is restricted or stopped, brain cells begin to die. This can lead to brain injury, disability, and possibly death. There are two main causes of strokes: ischemic, where the blood supply is stopped because of a blood clot, accounting for 85% of all cases. Hemorrhagic, where a weakened blood vessel supplying the brain bursts. There's also a related condition called a transient ischemic attack, TIA, where the blood supply to the brain is temporarily interrupted. This causes what's known as a mini stroke. It can last a few minutes or persist for up to 24 hours. TIAs should be treated urgently, as they're often a warning sign you're at risk of having a full stroke in the near future. Get medical advice as soon as possible, even if your symptoms get better. Certain conditions increase the risk of having a stroke, including high blood pressure, hypertension, high cholesterol, irregular heartbeats, atrial fibrillation, and diabetes. Treating a stroke. Treatment depends on the type of stroke you have, including which part of the brain was affected and what caused it. Strokes are usually treated with medicine. This includes medicines to prevent and dissolve blood clots, reduce blood pressure, and reduce cholesterol levels. In some cases, procedures may be required to remove blood clots. Surgery may also be needed to treat brain swelling and reduce the risk of further bleeding if this was the cause of your stroke. Recovering from a stroke. People who survive a stroke are often left with long-term problems caused by injury to their brain. Some people need a long period of rehabilitation before they can recover their former independence, while many never fully recover and need ongoing support after their stroke. This service helps the person recovering from a stroke learn or relearn the skills they need to live at home independently. Preventing a stroke. You can significantly reduce your risk of having a stroke if you 1. Eat well, 2. Take regular exercise, 3. follow alcohol advice, like not drinking more than 40 minutes a week. And 4, quit smoking. If you have a condition that increases your risk of a stroke, it's important to manage it effectively. For example, taking medicine you've been prescribed to lower high blood pressure or cholesterol levels. If you've had a stroke or TIA in the past, these measures are particularly important because your risk of having another stroke is greatly increased. Some people will continue to need some form of care or help with their daily activities.